Our great healthcare workers at Covenant have spent this last year doing everything they can for patients to get those folks back with their families, all while trying to stay well themselves.
Yeah, our Matthew Stell rejoins us now. He sat down with the leaders of the health system to talk about how life has changed for them and the way that they give care for those who are in need.
We actually got our first coronavirus patient, I think it was on the night of the 13th. I think they were in the ER the night of the 13th and then admitted to the hospital early in the morning hours of the 14th of March. From there, the plan was to make sure that we had enough personal protective equipment to protect our nurses and our doctors. That was a big challenge because every hospital in the country was suddenly faced with this epidemic of needing more personal protective equipment than they had ever ordered or stocked in the past.
Quite honestly, we worked through a lot of fear. Nurses were scared. Some did feel like they couldn't go home, so they had to either live with someone else, or some lived in an apartment or a motel room. It was tough.
A lot of my job, especially early on, was trying to keep calm. Making sure that we have all of our stuff operationally that we need in working order, making sure our medical staff feels like they're prepared. There was a lot of long days, a lot of long nights of just talking to different people, getting different opinions out there, making sure we had consensus on what we were trying to do.
It's almost like it rolled across the country in a wave. I jokingly likened it to the wave at the Texas Tech football games, where you see part of the stadium standing up and part of the stadium sitting down, and that's kind of what the pandemic did nationally.
I have vivid memory of one of our first families that I personally took up to visit their dying father.
It was rough. It was rough to see our caregivers come to work and not feel like they could be successful as we traditionally have been in healthcare.
I can say 11 months later, the staff feel much more secure in providing care to the COVID patients. There certainly is some respect for the virus, but there's not the same level of fear that there was a year ago.
What I learned was that our hospital staff, our physicians, our nurses, are incredibly resilient. They rolled their sleeves up, they went to work. None of them said, I'm not going to do this, I'm not going to take these risks. They literally stepped into the void and did exactly what professionals are supposed to do.
And I think it comes down to personal responsibility. If you're going to be a leader inside of this community, you have to have a personal responsibility to take care of the people who work for you.